I try to make the point to the families, because where you tend to see the disparities in this is that the patient, and it's almost a blessing, is not necessarily aware of their cognitive deficits. And it makes it very difficult for the families. So I try to focus on the notion that, all right, your loved one has a brain disease. It's not about anything about your relationship. I try to reinforce the tools that can be used in a setting in which someone repeats repetitively, how you can redirect, how you can, when to agree, when to set limits, those kind of things. So I think that's where patient education and family caregiving education is so critically important. In this regard, I think a shout out to the Alzheimer's Association is warranted. I mean, one of their major emphasis is to focus on caregiving and doing a really good job. And they have educational tools that makes it, at least gets people a basic fundamental understanding of the disease. It's been vetted over and over again. I think it's a good place to start, and I recommend just I say alz.org, alz.org. Go there. The other thing is, and I know it's hard for my colleagues in private practice to spend the time, but a tincture of time to answer the questions for the family can be hugely profitable for the long-term care, because oftentimes they're fairly straightforward problems that can be answered fairly quickly that will avoid having catastrophic problems such as what we call the patient eloping. They're confused, they leave the house, and we can't find them for 2 days, and then there are all kinds of problems, or repeated hospitalizations due to the fact that they are not taking their medications correctly because they won't let their loved one give them the medications in an appropriate way. And all these things can be addressed in the clinic if you have just a few extra minutes. Yes. So this is a really important fact, is that Alzheimer's destroys the brain, okay? It is a terminal diagnosis. Your brain will fail. Okay, your brain controls all kinds of things, but importantly, how you eat, how you sleep, even your weight. What tends to happen is Alzheimer's patients die because either they have trouble with swallowing and they inhale their saliva, or they inhale chunks of food, or they stop eating altogether. So they get a pneumonia because they've inhaled their food or their own saliva and die that way, or they stop eating and they die of what we call inanition, which is really a fancy term for starvation. They just stop eating. The answer straightforward is absolutely. They raise awareness. The thing that I struggle with the most is that awareness is not uniform. So if you're an upper middle class white family in the United States, okay, you're going to know a lot about Alzheimer's disease, okay? But if you're an immigrant from another country, you may or may not know that about Alzheimer's disease. And what we're not very good at is disseminating that information out to our diverse populations, which I think is really critically important, because Alzheimer's disease and dementia in general does not know any racial or ethnic boundaries. Everyone gets it. It's been going on since the dawn of time. It just wasn't such a big deal because people didn't live long enough to make it relevant. Now, so many of us are living to the age of risk for Alzheimer's disease that we need to disseminate this information. And particularly if English isn't your first language and you have cultural barriers to talking about these kind of things, such as late life dementia, then I think it's really critical to get that information out. And I know UC Davis Alzheimer's Disease Center is trying very hard to do that, particularly here in Sacramento, where we're sort of like a diverse a population, probably one of the most diverse in the country here. My hope, and I feel some modest amount of optimism about this, is that we're going to get to the place with combining diagnostic imaging with therapeutics to prevent the development of the dementia. I believe that to be true. Early diagnosis and early implementation of treatments, yet to be determined, but there's some small glimmers of hope in the immune treatment area. But that primary prevention of this disease before the dementia occurs may be the way to go. It's analogous to treating blood pressure, treating blood sugars before you get into the heart attack or the diabetic state, which I think we will forever have difficulty once the brain has been injured to reverse that process. I think that if you get to the place where the person is confused, reversing that end stage, if you'd like to use that term, process is much, much, much more challenging. It's just like someone having a big heart attack. It's a lot harder for them to survive than it is if you have angina and you address the underlying problem before you have the heart attack. I mean, that is the ultimate goal, a world without Alzheimer's, to quote the Alzheimer's Association, sorry. A world without Alzheimer's disease would be fantastic. I suspect that there will always be people who come in with a dementing disorder because they haven't been diagnosed early enough. Even now we see that happening with a host of diseases. People come in not knowing that they had high blood pressure with their heart attack, not knowing that they had cancer and come in with advanced cancer. So those are the kind of things I think we won't ever get away from. But that said, if we go down this road, I think we'll make a lot of progress.